couple come to us, so there is a gender equality right at the beginning. When the couple enters your consulting room, right at the beginning we emphasize, no, this is the tali do hath se bajti hai na. So, and in that tali, the man's tali is much more easier than the female tali.
Hi everyone, this is Dr Mahima Bakshi. Welcome to my show. My today's guest expert is Dr Hrishikesh Pai, gynecologist and infertility specialist from Mumbai. He's also the medical director of Bloom IVF and has got more than 6 centers across the country. He's also been the past FOXY president and is currently the trustee for FIGO, which is the Federation of International Association of Gynecologists and Obstetricians. So, hi sir, welcome to the show.
Hi, Mahima.
So first of all, I'm grateful to you for taking out time for this podcast episode. And a lot of women are very worried about how are they going to plan to have a baby, especially couples having problems in conceiving. So I'm all excited to be talking about all that with you today.
Great. I'm looking forward to interacting with you.
Thank you so much, sir. So, sir, let's begin with knowing more about you first. So, sir, why don't you tell us more about yourself?
Yeah, that would be a good to start with. So, my name is Dr. Hrishikesh Pai. I'm a gynecologist and I graduated from the, illustrious KEM Hospital and St. GS Medical College way back in 1985. Since then, I'm doing gynecology, and during my lifespan of and my career, I've been one of the pioneers in the field of in vitro fertilization. I went to Melbourne, Australia in 1989-90, did my fellowship in one of the largest IVF centers in those days, in Ian Johnston in the University of Melbourne, and came back and started IVF in 1991. And at that time when I started IVF, there were only 10 people in India. I was one of them, and then of course in 95 I started Bloom IVF group along with my colleague Dr. Nandita Palshetkar, and also my better half Dr. Rishma Pai was also a part of that group. And we have evolved and we at present have 6 centers all over India, including 4 in Mumbai and 1 in Delhi now and 1 in Mohali, and we also operate 5 more other centers of other people. And over the years, I've had a lot of new breakthroughs. I also, in the same time, I did my parallel career in profession. I became the president of the IVF Society of India. It's called ISAR. I became the president of the Endoscopic Society of India, which is called IIG. I became the president of the Federation of Obstetric Gynec Societies of India, which is called FOXY, which is nearly 277 societies. We have 43,000 members. And presently, as luck would have it, I just have got elected as the trustee of the world body. We have a world federation of obstetric gynecology of 135 countries, which is called FIGO, International Federation of Obstetric Gynec, and I am the trustee for Asia Oceania, which has 26 countries. So, it's been a fantastic ride, and parallel with that, I also did my IVF work, which is my passion. I look at it as a passion. It's not something which I look at as money making or something. I love to serve people and I love science of IVF, and that keeps me going.
Lovely. I think with so much vast experience that you have, you'll be able to share so much of knowledge with our viewers today, because a lot of couples have a lot of questions in their mind, and normally there's a habit that people go to Google for everything, but we want to pass on the right information to them so that they know how and when to plan the pregnancy and which are the right experts that they must contact in case they are facing any issues. So, sir, considering the infertility rate in today's time in India specifically, how do you think that has drastically increased over the years?
Yeah, so overall, we have been always taught in medical school that the incidence of infertility is around 5 to 10%. So if there are, let's say, 10 couples who get married, and by year's time, nearly 8 or 9 will have a baby naturally, and one of those couples will not have a kid, and that is tagged as an infertile couple. So you need to try for at least 1 to 2 years, and if you still don't achieve a pregnancy, then you can say, okay, you are staring at the problem of infertility. Of course, that changes because the definition is dynamic, and if you are more than 35, then we would say 6 months to 1 year. If you are less than 35 years of age, especially the woman, then you can try for 1-2 years, be more relaxed about it. And still, if you don't achieve pregnancy, then you can start sounding the alarm bells, kind of. But if from the scientific perspective, World Health Organization recently did analysis of 12,000 studies which were published about incidence of infertility worldwide.
Okay.
And they narrowed these studies down to 120 studies, and they have found that the prevalence rate of infertility is 17.5%.
It's also important that, sir, that, there are so many couples wherein I also see that the mother-in-laws, specifically think कि बच्चा नहीं हो रहा है, इसका मतलब बहू की वजह से infertility है. A lot of men in the society still have this taboo in accepting the fact that they even need to go for a testing. So testing के लिए भी कई बारी couples में husbands जो हैं वो जाना ही नहीं चाहते हैं. So if you would like to talk about that aspect so that we can create awareness through this video, तो आप प्लीज उसके बारे में कुछ बताइए.
I think that the amount of men contributing to infertility is 50%. So 50% of the time it is the man who is responsible for infertility, and it's very simple because you just do a semen test. While in a woman it's a very more complex. You have to do a lot of tests. You have to do ultrasound, laparoscopy, blah blah blah. So compared to that, a man, it's just he does just a semen test. So first thing we always do if a couple comes to us, we first do the semen test. We first test the male. Okay. If the male is having a problem, then we don't have to go to the female, right? Because female testing is more difficult. So it's so in our practice, obviously we always like to have the couple come to us. So there is a gender equality right at the beginning. When the couple enters your consulting room, right at the beginning we emphasize, this is the ताली दो हाथ से बजती है ना, तो and in that tali, the man's tali is much more easier than the female tali.
Right.
To test.
Right.
So semen test is very simple, 3 days of abstinence, and then you just give a test everywhere all over the.
And sir, if we talk about the causes specifically leading to male infertility or female infertility, so according to you, what are these common causes? Why is the rate increasing so much?
The overall in the male the counts are going down. They have shown that over the last 3-4 decades the counts have slowly fallen down, and WHO keeps on changing the normogram. Means what is normal is changed every decade. So that one of the reasons is that contamination levels are more, stress is more, food is contaminated with estrogens, heavy metals. So overall, because the semen is a proliferating kind of cell, it gets affected by all these things. So that is one of the main causes that it is falling down. The other causes, of course, can be many. You can have a swelling around the testes, that is called a varicose swelling of vessels, and high temperature can cause decrease in the count. You can have other like infections, you can have blockages in the conduction system of the sperm, and you can have genetic problems. Some of them may be genetically abnormal. The chromosomal component may be normal. So when the count is poor, then we start looking for the cause, and in many cases we get to know the cause and we treat the cause. But in many people it is called idiopathic oligospermia. I mean, there is no cause. It's overall the counts are down, or the motility is down, or the morphology, means the way the sperm looks, the formation of the sperm, it's called morphology, that is abnormal. So we always look at 3 parameters: the count, the motility, and the morphology. See, one of the parameters or all of these parameters may be abnormal. So we first look at it and look at the causes. If we can have a cause like a varicocele, we do surgical correction. If there's an obstruction, we'll overcome the obstruction by doing a surgical correction. We give them a lot of supplements to improve the count. We give them what is known as SERMs to improve the count. So with all this, some gonadotropin injection. So with this, we try to tackle the male infertility part. And then coming to the female infertility, there are a lot of things, like you can have a problem in the when having relations. It's called, so in male also one of the big problems is erectile dysfunction can be there. He may not have the ability to have sex. So simple thing like that we may miss out on. So the question has to be asked to the couple: are you having a proper sex or not? She may have a problem. It's called vaginismus. So some women are very scared of having sex, and the vagina, they don't allow the intercourse at all. So that's called vaginismus. So that may be a problem. And then of course uterus may have a lot of problems. For example, you may have fibroids, adenomyosis, that is swelling of the uterus. It's called adenomyosis. It's the endometriosis of the uterus, or there may be large swellings or tumors of they are not malignant, but they are called fibroids, or the tube may be swollen with infection, that's called hydrosalpinx, or you may have endometriosis where the lining of the endometrium is outside the uterus, that can cause infertility, or a tube may be blocked. In our country, one of the biggest problems of infertility is blockage of the tube due to infections, which may be simple infections or may be sexually transmitted diseases like gonorrhea, or it may be tuberculosis. See, one of the biggest enemies of India is tuberculosis, and it affects every organ of the body, right from the head to the toe. You know, the common one is the chest one, but that if you are healthy, it's not so much the chest. It may be a bone TB, it may be a liver, it may be a heart, it may be a tuberculosis of the uterus as well. And over India में this very हमारे देश में बहुत common है ये tuberculosis जो है गर्भाशय का और नली से का tuberculosis से blockage हो जाता है, and गर्भाशय it totally damages, people go into amenorrhea, no period ही बंद हो जाते हैं. So tuberculosis is a major enemy, especially in the northern states of the country. And so then coming to other things like PCOS, so ovulation may be abnormal. So polycystic ovarian syndrome is a big, nearly 20-30% people may have it. And now with the lifestyle, more and more people are becoming obese. And also obesity is also a cause. So obesity not only may be there with PCOS, but in itself, obesity is a big cause of infertility. If you reduce your weight, automatically you may get pregnant. Yeah. You don't have to do any treatment as well. So this is where stress is another big problem. Stress is a major problem now. You know, I remember one couple, they were both in a bank, and both were in the international bank, and they said, "Doctor, we don't meet only. Where by the time we come in the night, we are so tired, we don't want to have anything to do with sex." The commonest test which every woman should do, I feel, as a rule, is the AMH. So anti-Mullerian hormone test. Even an unmarried girl should do that to see whether her ovarian reserve is okay or not. So because many girls are trying to get married at a later age. So how do I look at my fertility? Okay, at least do your AMH test. Just like in a husband or a guy. Suppose a guy say, many of them phone me and say, "Doctor, I'm not married, but I just want to know कि भाई मेरा सब ठीक है कि नहीं." I say just do a semen test. कोई भी जाके लैब में 3 days abstinence करो और semen test कर लो. अच्छा होगा तो you are okay. In a female, if that same question gets, "Doctor, I'm not getting married. I want to postpone my thing for 5 more years. I don't want to think about marriage." अच्छा चलो at least एक मोटा blood test करना है तो एक AMH करा लो. तो anti-Mullerian hormone and an add-on test to that would be अच्छा एक overall मोटा एक ultrasound करा लो. To see बाबा कुछ major issue नहीं है ना, uterus ठीक है ना, ovaries में कुछ swelling नहीं है ना, cyst नहीं है ना, endometriosis नहीं है ना, तो if you can afford an AMH plus an ultrasound, or if suppose ultrasound also not just an internal examination, कोई भी अच्छे आजू बाजू के friendly gynecologist के पास जाके एक internal examination करा लो, है ना, तो you are set. AMH में what AMH will tell you whether your ovarian reserve is okay or not. So normally in AMH the ovarian reserve is 2 to 3.5 nanograms per ml. If the reserve is less than 1.5, then you need to keep a watch on it. You don't have to panic. Recently I had a patient, a very well-off patient. She had met me 2 years back. Her AMH was less than 1. And just now, yesterday only I met her. And she said, "Doctor, I've had a kid now." So a lot of people with low AMH, they can also spontaneously become pregnant. It's not that they will not become pregnant. So don't get hyper. If you get a low AMH, doesn't matter. Okay, but it gives you an alarm signal. Okay, I have a low AMH, so I need to at least get married and have a kid, or nowadays you people.
Right. So I'm also going to ask you certain questions which a lot of people have in mind. Could be myths, could not be myths. So firstly, related to male infertility, if they are taking regular protein supplements can also lead to infertility. Is it true or false?
Yeah, it is because they may have androgens and testosterone in the supplement that can reduce their counts also. And that can also cause some kind of erectile dysfunction as well. So you must be very careful of your protein supplements. See that they are just plain proteins rather than having additional testosterone, anabolic steroids and all. Guys want to become look good and all that, but in the process may have a problem.
Right. Secondly, effect of diabetes on men. Can it also lead to erectile dysfunction
Yeah,
and higher
yeah.
chances of infertility?
Obviously, so diabetes. So when I think that guys also should do their glycosylated hemoglobin once in 1-2 years time. And India is the diabetic capital of the world.
Yeah.
Most of us have got parents being diabetics, and if you have a family history of diabetes, there is a high chance that you may develop diabetes. So of course, a traditional glucose tolerance test will be great, but if not, a fasting blood sugar and a glycosylated hemoglobin once in at least 2 years before the age of 40 is quite okay.
Even school kids these
Yeah,
days
yeah.
are
So
having
that is called
diabetes.
juvenile onset diabetes. So one मोटा एक 20-25 बरस में एक टेस्ट लगाना अच्छा है. एंड इंडिया में क्या है, द टेस्ट आर सो इजी. घर में आके करते हैं आजकल टेस्ट. तो बड़ी बात है.
Home collection.
Home collection. As I told you, Indian country is a very, like, once there is a technology, just like mobile phone, सबके पास मोबाइल है अभी.
Right.
तो जैसे टेक्नोलॉजी इंडिया में बहुत ही फास्ट स्प्रेड होती है.
Absolutely. So third question, increasing age, the way it has an impact on women fertility, does it also have an impact on male fertility?
Yeah. So after the age of 45-50, I feel that men should, and if they don't want to, then they should also preserve their fertility. They should also freeze their sperm.
Yeah.
I feel that of course that's not scientifically proven, but practically I feel if a guy doesn't want to have a kid before the age of 40-45, he should freeze his sperm when he's young and keep it.
Right.
For the long term.
Right. And in women, a lot of women think they have PCOD, तो इसका मतलब natural conception हो ही नहीं सकता. How true is that?
Not at all.
Yeah.
PCOD is just a ovulation. I'll give you an anecdotal. It was one of my friends. She was a gynec. She was such a high PCOD that she never used to have period. Okay. She had 3 kids and then she had to even do abortion because she. Because of PCOD, there's a huge amount of eggs in the ovaries.
Right.
So one of the biggest things in IVF is if you have more eggs, then you have more embryos. If you have more embryos, then the chance of pregnancy is very high.
Okay.
So PCOS is, so if a PCOS patient comes to me for infertility treatment, it's very easy. I'm very happy. They'll become pregnant. Of course, because it's the ovulation issue. Once you get the ovulation right, and if ovulation fails, then there are so many eggs, you can make so many embryos. So there is no dearth of pregnancy at all.
Right. Also, my next question is use of mobile phone, carrying it in the pocket, the pant pocket. Does it have an impact on fertility?
There is some studies that have shown that the count may go down, and also it's better to guys to keep it in the back pocket.
Okay.
Because if you keep it on the front pocket here, then it may affect the heart.
Yeah.
So we don't know. So I feel that, and I also feel that we should use the traditional way of listening to the mobile. I always use my headphone with the wire. I don't even use those Bluetooth ones. I'm scared because I feel that it may
can affect the ears.
because there are waves going down directly to the ear. We don't know.
Yes.
So I personally prefer the organic way. More organic you are, less tech savvy you are, better it is. I feel in the longer. I may be wrong because many of these things are just gut feeling. See, in medicine there's a lot of gut feeling. I feel I'm a gut feeling kind of doctor. I use science, I use studies, but I still go by my gut.
I think a little traditional approach is also good.
Right.
Yeah. Also, sir, since we are talking about infertility and fertility preservation, nowadays we also see a lot of young people being diagnosed with cancer, going for chemotherapy at an early age. What are the consequences on fertility on both men and women?
So if a young person is diagnosed with cancer, then obviously the treatment has to start very quickly. And the second thing is, normally the treatment is a combination of chemo and radiation therapy. So if there's a heavy radiation therapy or there are certain chemotherapeutic agents, mild, medium and severe. They are classified low risk, middle risk and high risk. So based on the type of chemotherapy, because different cancers have different types. So certain types, they will totally destroy the ovary permanently. So those are the ones where we offer. There are certain times if they take it, we know that they will recover fully and they can have spontaneous children after that. But there are certain types who are very, very aggressive agents which destroy all the follicles in the ovary. And these are the patients where we have to then offer them fertility preservation. But somehow in India, I have failed, I would say, in the area of fertility preservation for cancer. So there are 2 areas of fertility preservation. One is for patients who are young, who have cancer, who, to prevent the damage of the ovary, you are going to freeze their eggs, so that once they get their treatment done, and nowadays a lot of cancers can be treated 100% cure is there.
Yeah.
So after their cure, once they get married, because their ovaries have got totally destroyed, or their semen is got totally destroyed, they use the frozen eggs or frozen ovarian tissue or frozen sperm to have pregnancy in the future. So, but when they come to me for this kind of patients, you have to counsel them well. So I tell them that there are 3 options for you. One is you can preserve your eggs or the ovarian tissue. The second option is you can go for egg donation also, or sperm donation, and third option is you can go for adoption. So when we give them all the 3 options, I have found that in India, because people when they have cancer, they are totally focused on staying alive. They don't look at the next step. And plus, secondly, this out of pocket. So like in most of the Scandinavian countries in Europe, cancer preservation, for fertility preservation for cancer, it is state funded. So okay, it's an automatic thing. In India, it is all privately driven. So they say, अच्छा ये भी अवेलेबल है क्या? हाँ, जब बाद में एग डोनेशन भी कर सकते हैं और बच्चा हो सकता है क्या? अच्छा, एडॉप्शन भी कर सकते हैं क्या? So if we give them that kind of counseling, then they say नहीं, then sir मैं अभी इधर इतनी फोकस हूँ ना, मेरे सर्वाइवल पे मैं फोकस हूँ, मैं कहाँ जाके एग निकालूँ या कहाँ जाके ओवरियन टिश्यू निकालूँ, और मैं नहीं, मेरे को पहले जिंदा रहने दो, बाद में अच्छा आपके पास हम आएंगे, बट एग बोरो करने के लिए आएंगे या एडॉप्शन के लिए आएंगे. तो they don't go for cancer preservation. In my experience, I failed. I've contacted so many of my oncology colleagues, I've done seminars, I've talked about it, but somehow people have begun this. What has come to me, because I was a pioneer of egg freezing in the country, fertility preservation for lifestyle or for other softer diseases like endometriosis, etc. These is huge in our country. Philosophically also, because these are the patients who, when they come to us for preserving fertility, they are not that financially well off. So don't worry, uncle is always there for you. I'll preserve it at any cost, because it's not, as I told you, in my life, I look at profession as a science. It's an excitement, it's a passion for me. It's not at all money. If I wanted to make money, I would have been a businessman. Why would I become a doctor to make money? So I have very clear-cut thought process in my mind. A medical profession is to serve the people in your society, in your country. Money is a byproduct of your profession. It's not my be-all and end-all of my existence as I look at it.
Very well said, sir. I think, I hope this message, reaches the right kind of people there in the audience, because I think you very nicely, beautifully put it. Also because we are talking about, infertility options of, like you said, some couples might go in for adoption. There was a time when a lot of people were going in for surrogacy. We saw a lot of Bollywood celebrities also back to back going in for surrogacy. And we understand that now the commercial surrogacy has been banned. So, what are your thoughts on that?
Yeah, so in our country now, the new law states that only for medical reasons you can do surrogacy. Fair enough. So, patients who have had no uterus or absent uterus or underdeveloped uterus, many people, they are born with the uterus not being there. Or if the uterus is it's a small nodule. It's called Rokitansky-Kuster-Hauser syndrome. So, this is quite frequent. And these people can obviously go for surrogacy. Or patients in our country, I told you, the biggest scourge, the biggest curse of India at present. It's not COVID, it's not hepatitis, it's not anything, it's tuberculosis. Tuberculosis is our curse. And we have fought it well. The governments over the years have fought it. So that damage to the ovary, to the uterus, to the ovaries, to the tubes, it's very aggressive disease. So those patients, then patients who have medical problem, heart disease, severe, where they can't have a child because of medical problem. These are the patients, and so these are the patients who can go for surrogacy. In the olden days, anyone could do it. But with the new ART bill, these are the patients that can go for surrogacy, and there are a huge amount of these patients in our country.
Right.
Numbers are huge.
Right.
And of commercial, because so what is the meaning of that? that patients cannot be given paid money for having the child, and there are certain restrictions. And the new ART bill and surrogacy bill, you have to take a permission. So you must have a medical indication. Then you have to have, there's a surrogacy board, and you have to have a magistrate's permission, and the clinics are regulated. But I feel regulation is good because more people can have access to it.
Yeah.
So once now the new licenses are coming in, and once we get adjusted to it, and once the government, ultimately government makes the rule. But
sir, and I hope that one and the most important thing for anybody is good health, and I'm just trying to create more awareness on women's health, preventive health, and I'm hoping that a lot of our viewers जो भी ये देख रहे हैं, सुन रहे हैं, हमारे लिए ये ज़रूरी है समझना कि आपको अपनी हेल्थ का खास ध्यान रखना है. रिप्रोडक्टिव हेल्थ भी उसी का एक हिस्सा है, और उसी के लिए हम इस तरह की अवेयरनेस वीडियोस क्रिएट कर रहे हैं. सो सर, एनी फाइनल मैसेज फॉर द ऑडियंस?
No, final message. There are two messages, I would say. One is that health is very important. So, like in health, of course, as we grow older, the thing that all of us would ultimately die of is cancer, or we would die of a disease like blood pressure, diabetes, etc. So, health checkups are very important after the age of 40, because if you catch the disease young, you catch diabetes young, you can, do changes in your lifestyle and survive. Everyone wants to survive. Ultimately, that's what it is all about, isn't it? It's all about survival, and perpetuation of your species. Means survival and reproduction. So even if you die, you will be perpetuated in the future by your progeny. So my line is also very important part of survival. So you must have a proper health checkup right from the early days. A pap smear. Vaccination is very important also. Now there is a cervical cancer vaccine also available. So you must take the vaccine. Vaccinate your kids. If they are between 9 and 14, you should vaccinate them against cervical cancer. Vaccinate them properly against other things. Every year you must take an influenza vaccine if you have the money, and you can do that to prevent, especially when you are older. When you are at the age of 60 plus, you must take the the vaccine which is against herpes. Of course, Shingrix is the only one available, and maybe there are some other ones also. And at the age of 65, you must take the pneumococcal vaccine. So these are vaccines that are you must do your blood sugar checkup. You must do your blood pressure checkup. You must do your cancer checkup all the time. And you must do occult blood in stools to look for colon cancer. Once in 6 months, do an occult blood in stool test, and do an ultrasound once in 1-2 years time. कुछ बड़ा कुछ मास भी साथ होएगा तो immediately समझेगा. For guys, you must do the PSA, prostatic specific antigen test, which will pick up the prostate cancer at an early age. For women, you must do your breast checkup every day in the morning. When you take a bath, you must check your breast digitally by hand. So you will immediately, if there's a lump, you can go to the doctor and check whether there's a problem or not. That's as far as the general checkups are concerned. And any woman more than 35, if you have not had a kid, you should preserve. Of course, many people feel that after 30 you should preserve fertility, but that's too inefficient, because many of the people, if you do it at 30, then what happens is many of you will get married, then the effort and the infrastructure in going and preserving your eggs will be lost. So ideal age to preserve fertility is between 32 and 37. Average mean age would be 35. Till 35, do your AMH test regularly once in 2 years. If AMH is falling and you don't think you're going to get married or have a kid, then you can go for a fertility preservation. You can preserve your oocyte. If AMH is normal and you can maintain your fertility, and you don't have to preserve your fertility. So it's a balance. So, and of course, we are always there to help you in this decision making. That is very important.
So, sir, thank you so much for this lovely chit chat with you, and you've covered such important facts, important discussions, and I'm hoping that this video is going to create awareness among people, because end of the day we want people to stay healthy, we want people to be happy, they should be able to have kids, the ones who want. तो जितना हम लोगों की help कर सके, हम कोशिश करेंगे कि इस वीडियो के जरिए हम help कर सके. And definitely Bloom's IVF के बारे में भी अगर आप बोल देंगे, so then patients will know where to come.
Thank you, Mahima. You have been a very good, I would say a great health activist, and you have been always, all the time trying to help people by giving them knowledge about health. And because knowledge is the important edifice, and that once you have the knowledge, then you can easily implement that knowledge in your own life. And so you have been a fantastic health, I would say, messiah to the people. And you please keep on doing this wonderful work that you're doing. And I would say that, I have been fortunate enough to have this Bloom IVF group, which has been our IVF group for a long time. And in Delhi region, we have in the Fortis, we have a center in Delhi, and in Mohali also we have a center with the Fortis group of hospitals. And in Mumbai we have 4 centers, and our lead center is in Lilavati Hospital in Mumbai. And Navi Mumbai we have at the DY Patil. South Mumbai also we have a center. Dadar we have a center. So we are very good in our work. We are serving the infertile people for nearly 30 years now. And the 5 important, so because we are a specialty group now, we get a lot of patients who are repeated IVF failures also. Another group which we have started getting a lot is the patients with poor ovarian reserve. That's a big area now, because a lot of women are getting married later, and by the time with the age their ovarian reserve starts going down, and they have not frozen their fertility when the time was correct. So then they are having a problem. So that's a very challenging group that we are facing at present. Another area is the egg preservation area. A lot of young ladies, women are coming for preserving their fertility with us. And another very exciting area is area what is known as pre-implantation genetic testing. So patients, in our country there's a lot of thalassemias and sickle cell anemia. So if 2 thalassemia patients get married, their children may have thalassemia. So normally the traditional way is to do the antenatal testing of the child, and if it is a thalassemia major, to do an abortion. Okay. But that's too bad, too traumatic. Now what we can do IVF and select the embryo which is a normal embryo, which doesn't have thalassemia, or it is a carrier embryo, and then put it back. So we don't need to subject them for abortion. So this is, and so another new area which is very exciting is what is known as couple screening, carrier screening. So a lot of new couples, they say, Dr. Pai, we don't want to wait till we have a first abnormal child. So what we do is we can do the genetic testing of both the couples. Okay. And so thalassemia or sickle cell is just one of the genes. Like that we have thousands of genes. So if both those genes are present in both the husband and wife, and it comes in combination, then it will have an affected child. So what we do nowadays, you can do the testing of both the husband and wife before they have their first child. Okay. And if there is a recessive gene which can cause the disease in both husband and wife, then we can test the baby to see if the gene is there. So before the first child gets affected, we can pick it up. Nice. So that's a new area, very exciting area which is there. And then of course, so these are one of the last thing is severe male factor infertility, which I also get a lot. So very, very low count, 2 million or 0 count, in which case we can do now with using a microscope, we can go into the testes of the male and do what is known as micro TC and take out the sperms and then inject them in the oocyte, create the embryos and give the pregnancy. So this is a big area which of specialty which we have in our group as well. So all this, and now recently we have added artificial intelligence. So one of the new things abroad is that in IVF what we do is we take the eggs, make the embryos and put them back. But many times we put 2 or 3 embryos back to increase the pregnancy rate. So in the process we have a higher incidence of multiple pregnancy rate, which is not good, because with multiple pregnancy rate the preterm birth rate is higher. Babies come out earlier. They stay in the incubators for a long time. They have damaged cerebral palsy or deafness or blindness. So most of the people in the world, most of the IVF centers, they are now putting only 1 embryo back. But if you put 1 embryo back, your pregnancy rate may go down. So there are a lot of now identification techniques available, by which suppose there are 4 embryos and you have to only put 1 embryo back to give a good chance. Thus, how do you find out which is the embryo, which is the best one? And using now artificial intelligence software, you can look at the embryo and the artificial intelligence tells you this is the embryo which you put back. It gives you the best chance of pregnancy. So in our group, we already have the artificial intelligence software. So these are certain new things that we are putting. Our group all the time keeps on innovating, and at the same time we are very much empathetic and compassionate about our patients, and we know that in our country price is a very big problem. People have to spend out of pocket, and we always try to give new technologies, good quality care at a reasonable cost.
So, sir, thanks a lot. Thank you so much, and seeking your support and guidance in future also. So, sir, thank you so much for this episode.
Thank you.
So don't forget to share this video, like this video with your other friends, and don't forget to subscribe to my YouTube channel. Thank you so much for watching. Bye-bye.